Hi, my name is Savannah White. I am from Mooresville, North Carolina, and I am in my second year of the surgical tech program. I've always had a love for the OR. I'm somebody who didn't want to do bedside patient care, but I still wanted to work within the healthcare field. There are many aspects to healthcare that people don't think about. Respiratory therapy and occupational therapy are both major components once somebody leaves surgery itself. We also offer community paramedicine, community health and wellness, and biomedical sciences. It's very much a team profession. This is a small campus, but everything that you need to thrive and do well is all within the same building. All of our major simulation labs are on the third floor, as well as faculty offices. All of our professors and faculty are very helpful. They know you by name. Everything is very personal and focused to your success. As a student at Cabarrus College, you get lots of hands-on experience. If you're going into allied health or into nursing, you have to take anatomy. It is the basis of what we do for work. You also will take microbiology, which tells you all of the importance of sterile technique. Our medical assistant lab is set up very closely to a doctor's office. They can practice vital skills, taking patient histories, setting up for different procedures, and they can really practice working alongside the doctor, helping and supporting them. Within the OT lab, there are walkers, crutches, wheelchairs, and many other amenities to help patients with recovery from surgery, an illness, or an injury. The surgical tech lab is set up as an OR. We have scrub sinks and all of our supplies where you can grab gowns and gloves. There's also tons of skills that are learned as well, like draping the patient, prepping the patient, loading blades, loading sutures. Your first year, by December, you will be able to do a surgery from start to finish. In January, they will start scrubbing in the real setting. As a first year student going into my summer semester, I was offered a job working in surgical technology for Atrium Health before I've even graduated the program. As we are Atrium affiliated, we have lots of access to those sites, and we are allowed the opportunity to focus on the clinical portion of our courses. The college really makes sure we are prepared to help those patients in the best way that we can.